Yeah,
some pressure there.
Yeah, for
Is
sure.
it painful or just?
Just feels pressure. Not like shooting pains, no.
No signs of cloudiness or anything there.
Left, right.
Very good.
Sharp. 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 Soft.
Hi, Hannah.
Hello.
How's it going?
It's going okay.
Okay, it's nice to see you today. My name is Dr. Perez. I know we met briefly in the waiting room, but welcome to the office. It looks like I have you down as a referral today.
Yeah.
So your primary care sent me over your file. Looks like you've got a little bit of vertigo going on.
Yeah, I've just been, sometimes I just wake up in the morning and I'm very dizzy, and it takes like a few hours for it to sort of settle.
Okay. Is that specific to morning time, just when you wake up?
It's definitely worse in the morning. I haven't really noticed it too many other times, but every once in a while I'll just get this like sort of swooping dizziness.
Okay.
And that usually goes away pretty fast, but the morning thing.
Do you notice it while you're lying down in the morning, or is it once you stand up?
It's more once I stand up. Sometimes, like I feel like it's on nights I don't sleep very well, or like I'm tossing and turning, I'll notice when I turn my head, I feel quite dizzy.
Okay.
But then when I stand up, that's definitely the worst.
So kind of positional a little bit. At any point throughout the day, maybe extended periods where you haven't eaten anything, do you also feel a bit of the dizziness, or not particularly?
No, it doesn't seem to be aligned with hunger in any way.
No previous injuries. I didn't see anything notated about like a head injury or concussion or anything.
No, never had that.
Okay. So I'm going to ask you a couple follow-up questions just so I can kind of get a little bit of a better idea. Let's start with your head in general. Have you noticed any abnormal lumps? I will check a little bit later on, but any lumps, bumps, no bleeding anywhere, obviously. Do you wear any prescription contact lenses, glasses?
I don't.
No. Any issue with your eyes recently, pain or pressure?
Yeah, a little bit of pressure maybe.
Pressure. Okay. Is it pressure like behind the eyes?
I think so. I know I've noticed that it hasn't felt like 100% normal, but I can't really pinpoint what it was.
That's okay. Okay. Any issues with your vision as far as like blurry vision, double vision, seeing like floaters of the vision or any lights?
Sometimes when I'm really dizzy, it can feel kind of hard to focus my eyes.
Okay.
But no blurriness or double vision. It just kind of feels like uncomfortable.
Okay. How's your screen time?
High.
Okay.
Yeah, a lot of screen time. I try to put my phone away before bed, but sometimes I fall asleep watching it.
Okay. All right. So definitely something notable there. Obviously, the increased screen time can put extra pressure on your eyes, so it might not be the cause of the issue, but certainly isn't making it better.
I would say I get like less than some people just because I'm not on it all day,
Okay.
but I am more on it like in the evening
In
when
the
I'm
evening.
relaxing.
Okay. And that's usually the time that we try to stay away from it if you can. So if nothing else, you might consider wearing like a blue light blocking pair of glasses. They don't have to be prescription, or you can also just set your phone to like a night mode where it just gives you like a bit of a warmer tone. It's just a little bit better for your eyes. Okay. Moving on to your ears. So any like pain or pressure of the ears, abnormal discharge or bleeding or anything like that?
Not that I've noticed.
Okay. No history of like chronic ear infections or anything?
No.
Okay. All right. Okay. I will have a brief look at like your nose and throat area. Any issues with your sinuses, seasonal allergies, anything like that?
I definitely do get, seasonal allergies.
Seasonal allergies are pretty common. All right. No abnormal tastes, smells, nothing like that. Okay. So definitely going to be focusing most of my attention on your eyes, having a bit of an eye exam. I'll do an orbital exam as well, so just take note of that. Any trouble seeing in the dark?
Yeah, a little bit.
A little
More
bit?
than I used to. I feel like my night vision's gotten a little worse with age, but I can still see.
Okay.
I mean, not like in the pitch black.
Okay. Just a little more of a strain than it was previously, maybe?
Yeah.
Okay. All right. So I will do a little bit of a kind of a darkened exam. I'll dim the light in the room and just test a couple different things, test your color vision, that kind of thing, see if I see any abnormalities there.
Okay.
Obviously, I'm not an optometrist, but if I see anything abnormal, then I can refer you over to one. Okay. Any other issues besides that? Any concerns besides the dizziness? Anything specific that you wanted to mention?
That's really the main
concern.
Yeah.
Okay. Now, I did see that it looks like they took a set of orthostatic vitals and they were slightly abnormal. So when we did the standing, it was just a little bit lower, which does tell me that it is positional vertigo. So obviously you're here to kind of figure out what could be causing it, but I did just want to note that your orthostatic blood pressure was just a little bit abnormal. So the dizziness could be caused essentially when you're standing up, the blood rushes to your feet, kind of leaves your head, and that's what causes that like lightheadedness.
Yeah, sometimes when I stand up too fast, I'll
You feel it a little bit.
darken vision and feeling a little uneasy.
Okay.
It does go away though within a few seconds.
Okay. Well, I think that's all I need for now. We can go ahead and get started with the exam. I have a couple different things we're going to go over. Some of it will be probably familiar to you, like a basic eye exam. Some of it you might not have performed before, so I'll just let you know what we're doing, okay? All right, so we are going to go ahead and move on now. The first thing I want to do is just a very basic kind of visual assessment of your head and neck. So a lot of the time if there's something going on internally, there could be signs that I'm seeing if it's like facial drooping or just any abnormality in symmetry of the face. So I'm just going to have a look at you as a whole. So just go ahead and keep your head as is. Just going to look at the overall musculature of the face. So notating anything that looks abnormal, specifically at the eyelid. Not seeing any signs of asymmetry there. Certainly no drooping. Brows are fairly symmetrical. And the lower half of the face as well. Very good. Just looking at the shadow here symmetrically, that looks okay. Okay, so we can go ahead and move on now. The second thing I'm going to do is proceed with the remainder of the cranial nerve exam, and then we'll come back to the rest of your orbital exam. So I'm going to be shining a light in your eyes at certain points. I'd rather get the rest of it over with, and then that way we can do your eye exam, and I'll kind of let you rest for a few minutes before you leave. All right, so I am going to just check for any occlusions of your nose. You said you have no issues breathing normally, nothing like that, nothing feels occluded.
No, I don't think so.
Okay, very good. All right, so I'm going to come just a little bit closer to you. If I could have you just tilt your head back there slightly. Not noting anything too abnormal. I do see some slight inflammation on the left nair, but it doesn't look too bad. Okay, so if I could just have you open for me briefly and say Very good. Okay, so uvula is midline and your throat is clear. No signs of any reddening or whitening, which could indicate a fungal infection, so that is very good. Now, I'm going to occlude either nair. I'd like you to just attempt to breathe in for me. And here. Good, and both. Okay, so if I could have you close your eyes for me, I have two different scents that I would like you to smell. Fairly common, they shouldn't be too difficult to identify. So here's the first one.
I I know it, but I'm like blanking on the name. It's very like floral.
It is. Okay, so that's lavender. So floral will count for that. That's okay. Now this one is also very common, but vastly different than the first.
Yeah, that's like citrus, like orange or lemon.
Very good. So that is lemon. So seemingly no issues with your sense of smell. I'm not going to test your sense of taste. Obviously, you're saying you can taste everything fairly well. So we can go ahead and move on. Now, secondary to that, I am going to test kind of jaw movement, test for any rigidity there. So very brief test here. Do you ever have any issues with clicking, popping, anything like that?
No, I don't.
No history of any orthodontia or anything specific?
I had braces as a kid when I was around.
Do you wear a
12 or
retainer?
13. I do. I wear a retainer every night, yeah.
Okay. So I'm going to have you just move your jaw side to side for me. Good. And then open and close. Good. So no issues with that there. Okay. So I'm just going to hold at the thyroid here. If I could have you swallow. Perfect. Okay. So all of that looks fairly normal. That's fine. Okay. So we can go ahead and move on now. I'm going to do a bit of a hearing test and just want to have a brief look in your ears to start with. And you said you're not having any abnormal discharge or anything. Do you use Q-tips or anything to clean your ears, like when you get out of the shower?
I just will take like a piece of paper tissue and just do the wetness.
So not actually like inserting in your ear?
No.
Okay. So I'm going to have a brief look in your ear, just look for any abnormality there. But very good. Okay, so just have you turn your head for me. So your tympanic membrane is very visible. No signs of cloudiness or anything there. Good. Okay. So just a brief hearing test here. I have a couple different things that I will test for. So I'm going to have you close your eyes if you're comfortable. Now, first thing is just going to be a very soft noise with my hands, and I'd like you to just indicate if you can hear it, okay?
I can hear it. I can hear it. I can hear it.
Very good. Okay. Now, I have another tool here that's going to produce a clicking sound, just to give you an example. You hear that? So if you could indicate to me what side you hear it on. Okay, switching tools now, but same thing. Just let me know what side you hear it on. Good. Now directional hearing, tell me what side it starts and what side it ends.
Starts right, ends left. Right to left. Left to right.
Very good. Okay. Now lastly, I'm going to produce a very small puff of air. Try not to pay attention to the feeling so much as the sound of it. Some of it I will purposely point away from your head just to ensure that you're not focusing too much on the sensation aspect, okay? Very good. Okay. So I would wager to say there's nothing wrong with your hearing. You're able to hear everything appropriately. Obviously, you can hear me at a normal speaking level, so that's good. Okay. All right, so while I'm seated fairly close to you, I'm going to do a quick check of your upper extremity reflexes. So first, starting at your chin, I have a bit of a reflex hammer here. I'm just going to use this to tap along your jaw. So just hang open for me kind of loosely. Good. And then I'm going to check at your wrist. So if you just relax your wrist for me. Good. Very good. Good, very healthy the reflexes of the wrist. And then I'll have you relax with your hands palm up for me. Perfect. Good. Okay. So seemingly no issues with your upper extremity reflexes. Now the first part of your orbital exam is going to be done with the lights on. So we'll go ahead and perform that now. I'm assuming at some point you've seen an optometrist, whether it be at school or as an adult.
Yeah, it's been a long time.
Been a while. Okay. You don't wear prescription glasses,
I do
so.
not, yeah, and I never have.
Any trouble reading or no? Okay.
Just attention span.
Okay.
Nothing physical
So
activity.
this is a pocket chart similar to like the larger chart. This one I'm going to hold about an arm's length away from your face. I'm going to point to a couple letters and I'd like you to just read them out loud for me.
L, T,
Good.
O, L, C, F,
Good. And can you read that lowest line?
L, T, F, P, H.
Perfect. Can you tell me what color this is?
Green,
In here.
red,
Good. So I'm going to have you occlude your left eye for me. So just cover your eye. Can you read that bottom line for me backwards?
H, P, F, T, L.
Very good. So your vision is likely intact. Just have a set of cards here. I'm going to hold them up one at a time and I'd like you to just indicate the color for me.
Okay. Yellow, orange, red,
Good.
green, blue, blue.
So I'm going to hold two cards up and I'd like you to tell me if they are the same or different. So these two cards here, same or different?
Different,
Good. And here, same or different?
different,
And here, same or different?
different.
Very good. And lastly, same or different?
Same.
Okay. They are slightly different, but that's okay.
I wasn't sure.
You hesitated just a little. They are slightly different, but it's kind of a trick, so
yeah.
that's okay. Now this next one is in line with your vision, but it's also a bit of a cognitive assessment. So I'm going to hand you 3 cards. I'd like you to put them in ascending order for me. So there's 3 numbers, and I'd like you to place them in ascending order. Very good. And if you could read them to me.
3, 2, 1.
Perfect. Thank you very much. Okay, now I'm going to use this card here. It's got a bunch of little black squares on it. I want you to just look at it. I'm going to shine a light in your eyes. I want you to just focus on the card for me, okay? Good. I'm going to move it just a little bit. Very good. Now, while you were looking at the card, did you notice any dots appear anywhere?
Did not.
Very good. Okay. So that is great. Okay, so at this point, I'm going to go ahead and dim the lights. It's going to be fairly dark in here. The next portion of the exam will be heavily focused on the orbital socket as well as having a look at your optic disc. Okay? All right, so we are going to get started with the lighted exam. Now, it is fairly dark in here, but you should be able to see me, okay? Are you comfortable with the lighting? Okay. So the next tool I'm going to use is called an ophthalmoscope, and similar to the otoscope, it just allows me to see inside, essentially. So it's just going to allow me to visualize the optic disc, which is the disc at the back of your eye. So just adjust this slightly. Okay, so I will hold a finger up and I'd like you to focus on the finger as I come closer to your face. So excuse my proximity to you here. I just have to get closer. So I'll have you just look here. Very good. So your optic disc is visualized, and just have you look at my finger. Perfect. So I'll have you turn your head slightly towards me. Same thing, look here. Very good. Okay, so very healthy. Notable, I can see the vein, I can see that it's mobile, so all of that is a good sign. Now, going back to my pen light, I'm going to do a bit of a follow the light examination. So now have you look directly at the light and just follow it. Try to keep your head straight if you can. Good. Follow it out for me and all the way up. Good. So I'm going to have you look at my finger here, and I'm going to bring the light in here. So just checking your pupillary constriction and dilation. Okay. So I'm just going to use this here to occlude one side. So I'll have you just look straight ahead for me. Very good. So I have a reaction there. I thought I saw a slight delay, but okay. Now you do have fairly light colored eyes. Do you ever feel any sensitivity to light, or when you go outside, do you find that you have to wear sunglasses?
I definitely wear sunglasses, but I live in a fairly overcast place, and it's not that bad.
Okay. Nothing that you feel would be concerning, or like your eyes are just so sensitive abnormally?
No, but I have definitely had like sunburns on my eyes
Have
in
you?
the past,
Okay.
and so I've been really strict about wearing.
And was that
reading
after like
glasses.
prolonged exposure? Were you outside for a long time?
Yeah, it was like when I was a kid, and I would, like have a pool party, like go to like the town pool or whatever, and I would be out for hours. We'd be there for like 8 hours.
So specifically too, when you're around water, a lot of times it's actually the glare from the pool. So it's not obviously that you're looking directly up, it's the glare from the water. So that kind of makes sense, but obviously something to be cognizant of as an adult.
Yeah.
Okay. All right. So I'm just going to take out a couple things here. So these are just colored sheets. Now obviously it's fairly dark in here, but I am going to see how your color vision does in a bit of a darker room. So firstly, I'm just going to hold them up very simple. Just try to identify the color for me if you can.
Green. Blue. Orange.
Good.
Green.
Good. And lastly,
Blue.
very good. Okay. So, a bit of a variation here. I would like you to tell me if these two are same or different.
Different.
Good. And here, same or different.
Different.
Here, same or different.
Different. Slightly different. Yeah.
And just one more here. Okay, so this time I have 3, and they are obviously different. Now I'd like you to just point to the one that you would say is the lightest. Good. And can you point to the blue one? Good. And if you can point to the darkest green. Good. Okay. So no signs of color deficiency, even in pretty dim light. You're able to see fairly well, which is good.
I'm still feeling bad about that one I missed.
Oh, that's okay. It is tricky. I would say maybe 25% of patients get that one correct. I think a lot of the time they second guess it, kind of like you did. You think it looks different, but you don't want to get it wrong.
At least I'm in the majority.
Okay, so one more thing here for your orbital exam. Okay, so I'm going to do a brief look with your eyes closed. I'm going to have a look at your eyelids, okay? So You should see a bright light, but obviously it shouldn't hurt since your eyes are closed. So I'm just going to come over and just having a look mostly at the veinage of the eyelid, looking for any abnormal signs of protruding or any pressure. This also helps me look for any bulging of the eye, since you said you were feeling a bit of pressure there in the orbital sockets. Also just going to palpate here gently, feeling for any abnormal mobility of the eyeball. Okay, so keep your eyes closed, but look up for me. Very good. Okay. All right. All right, Hannah, so I'm going to turn the light back on and I'm going to come behind you, do some palpations of your sinuses and of your eyes as well. And I also want to feel around your head, and then we'll kind of go from there. Okay. All right, Hannah, so as I stated, this is the part of the examination where I'm going to be manipulating your head a little bit, feeling around your scalp. So I'll be performing some palpations, feeling around for any abnormalities at the cranium. Okay? I'm going to put on a pair of gloves. Are you experiencing any like abnormal lumps or bumps of the scalp? Any abnormal lesions?
No, I just get a little bit of dryness.
Dryness. Okay. So nothing more sinister, no head injuries, no recent falls, anything like that? All right. Is it okay if I just remove the ponytail?
Yes.
Okay. So I'm going to start first by just having a look at hair texture, overall hair health. Is this your natural hair color?
Mostly.
Okay. So just asking so it kind of allows me to look at any damage that could be related to hair color, but it does look like your hair overall is fairly healthy. Not noting any signs of brittleness at the ends or any abnormal splitting there. Got a fairly natural shine.
I am starting to get a few gray hairs.
Are you okay?
Yeah, just a few here and there.
Certainly normal. I have a couple myself. Is this typically where you part your hair?
Yeah.
Okay. So just having a look at the part specifically, looking for any signs of sun damage, which I'm not noting. No abnormal redness there. Okay. So I'm going to palpate around and I want you to just let me know if there's any pain or tenderness anywhere. So starting kind of at the hairline here. Frontal earlobe here. Back behind the ear. A little bit warmer here, but that can be normal. Any pain or discomfort here behind the ear?
No.
No. Okay. Very good. Alright, so going up top of the crown here, feeling around.
Maybe just a little bit of like uncomfortable pressure when you get closer to the top.
Okay. Is that typical for you, or is that a sign of abnormal?
I do have pretty bad spring allergies, so I do sometimes get headaches up there.
Okay.
But I didn't realize it would hurt when you touched it until just now.
Any pain back here at the base of the neck?
No.
Okay. So just a little bit of, so I will palpate around your sinuses and see if that's possibly related there. Just gonna have a quick peek here right at the hair part and looking for anything that I may have missed, but I'm not seeing any signs of freckling or abnormal discoloration. So I'm just gonna look here down across the hairline. I'm not noting anything either. So let's have a look at your sinuses while I'm back here. I'm just going to palpate first at the forehead. So
Yeah,
some pressure
yeah,
there.
for
Is
sure.
it painful or just
Just feels pressure. Not like shooting pains. No.
here at the brow as well?
Yeah, a little bit. Pressure. Feels like kind of like my eyes feel kind of pressured.
So if I come just directly underneath the orbital socket, do you feel pressure here?
It's not as much as above, but a little bit.
And how about here at the bridge of the nose?
No, that's okay.
It's okay. Just very gently directly above your eyelid. Do you feel pain or pressure here?
Yeah, pressure.
Pressure. Okay.
Pressure there as
Do you
well.
feel just a little bit of inflammation here at the temple for sure? Do you take anything on a daily basis for allergies?
I do, but I often forget, so I forgot to take it today. But I just take like a daily antihistamine.
Okay. Do you feel like that usually helps?
It does help quite a bit, yeah. I just forgot to take it.
So I would definitely say that it's likely just buildup from your seasonal allergies. Obviously, if you, unfortunate thing about taking like an antihistamine every day is that your body does build up a bit of a tolerance and then kind of a need for it. So it looks like right now you're in the phase where if you stop taking it for a day, your allergies might be a little bit worse. The only way to really mitigate that is to maybe stop taking it for a little while, kind of give your body a chance to see if it can accommodate naturally to the seasonal allergies. But honestly, if it's something that you suffer with chronically, then it's likely that you're going to need them long term. So
Yeah, this time of year is also just the worst because everything is blooming. So
absolutely,
usually by June, I'm okay.
it's lots of pollen in the air right now, and it's just not ideal. I'm just gonna put your hair back in a ponytail, and then I'm gonna palpate around your lymph nodes. Just want to make sure that there's no underlying sign of infection there. Does that feel okay? Okay. Start here at the clavicle, so just feeling around. So typically your lymph nodes are not actually palpable, so you shouldn't be able to feel them if your immune system is doing its job. If you are experiencing a bit of inflammation, then it could be a sign of underlying infection. So just gonna palpate around here, feeling for any nodules. And I'm really not feeling anything there, so that's okay. All right. Okay, so let's go ahead and continue with the rest of your examination. I'm going to come back around and we're going to do a bit more of a cognitive assessment, okay?
Sounds good.
All right. All right, Hannah, so completed the palpatory assessment and I did feel a little bit of pressure, as you said, specifically at the forehead region. There was quite a bit of pressure there. Not so much along the tear ducts though, so it does look like you've just got some of that seasonal buildup along the forehead. So obviously I would recommend continuing with those antihistamines now. The last thing we're going to do for your neurological examination is just complete a bit of a sensory assessment. So just kind of brief, making sure that there's nothing going on with your brain. So basically, because you've been having the dizziness, I more so think this is related to like a cardiac issue, or you're just having some issues with your blood pressure that's causing vertigo upon standing up. So what we would consider like positional or orthostatic. But anytime there's anything related to the eyes or pressure of the eyes, pressure of the cranium, we just want to make sure that there's nothing going on with the cranial nerves. Okay, so I have a couple different things that I will test here, and the first one is going to be just a very basic soft sensation. So this is just like a normal pad you would use to cleanse your face. Now, just to give you a bit of an example, you should just feel very light, very soft.
Yeah.
So I'm going to have you close your eyes for me. For this first one, you're just going to indicate if you can feel it.
I can feel it. Yes. 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 Yes.
And
Yes, it's not as strong.
okay. All right. Now, you probably will not be able to tell the difference here, but I do like to just check and make sure. So I have two different soft objects. This is the first one, and this is the second one. likely won't be able to indicate, but I do just like to check. So if you can, this will be 1 and this will be 2. Okay?
1, 2, 1, 2. I have no idea.
That's okay.
2, 1, 2, 1, 1, 2, 1.
Very good. So you actually got all of them right except for 1. You did very well. So now we are going to do a variation of a sharp test. So obviously the importance of sharp sensation. If you touch anything that could be particularly harmful, we want to make sure that you can feel it. So this is very sharp. It won't hurt you. It won't puncture the skin or anything, but just very distinct. So I'm going to have you close your eyes for me. Just indicate if and when you feel it.
Feel it. Feel it. Feel it. Feel it.
Good. So same thing here, sharp variation. So if you can tell the difference, this will be 1 and that will be 2.
Okay. 2. 1.
Good.
1. 1. 2. 2. 1.
Very good. Okay, so now I'm going to test a variation of the sharp and the dull. So you're going to feel either the soft or the sharp, and then just indicate which you feel, if any.
Soft. Soft. Sharp. 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 Soft. Soft.
Very good. Now, the very last thing is I'm just going to use my hands. You can keep your eyes open. I'd like you to just let me know if you feel any difference at all between the two sides. So obviously your hair is a bit in the way here, but if I touch your scalp here, any
No,
difference
it's the
there?
same.
Here?
Nope. Same. 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 Same.
Good. Close your eyes for me. Same there.
Mm-hmm.
Okay. So sensory response is normal as well. In conclusion, I would say that the assessment basically is slightly inconclusive. I do think that the pressure behind your eyes is unrelated to the dizziness. I think that's more so related to the seasonal allergies, unless you're noticing a correlation between the two eventually, but I don't think it's really related at all. So what I'm going to do following up is refer you to a cardiologist. So obviously your primary referred you to me. I am going to submit over that I don't think this is a cognitive issue. I don't think it's really related to you neurologically at all. I'm not noting any deficits. Your sense of smell was normal. Your eyesight is very healthy. And obviously your sensory examination was completely normal. So at this point, I'll refer you over to the cardiologist. Sometimes the referrals can take a little while, so I would look for like a 3 to 4 week wait time.
Okay.
Once you get there, they'll probably do like a stress test and have a look at your heart and see if anything could be going on there. In the meantime, obviously, if you notice any of the symptoms get worse or it is more significant in that you're passing out or losing consciousness, obviously, you would want to contact your primary care.
Okay. Thank you so much.
All right. I'm sorry I didn't have any more definitive answers for you today. But
It's good to know it's not neurological.
are you okay with a electronic referral?
Yes, I am.
Okay, so I'll go ahead and submit that all over to your portal and you can access that. All right.
Perfect, thank
Okay. Thank you so much, Hannah. I hope we can find some answers for you.